So I'm here to update on a case of
monkeypox
diagnosed in Victoria. Monkeypox is a pox virus
in the orthopox family.
related to smallpox, cowpox.
Some others not related to chickenpox.
It is a significant illness, but in the last week or so there have been a few dozen cases in Europe and North America, so cases in the UK, in Italy, Spain, Portugal, Sweden, some suspected cases in Canada, and now, as we know, a confirmed case in Australia. But it still has serious case fatality rates, so between 1 and 5% of individuals are reported as dying from that. There can also be respiratory transmission for people who are in close contact with each other, so direct transmission through respiratory pathway, or, as I say, that
close skin-to-skin contact.
And then a rash occurs with those typical chickenpox-like lesions that occur, so fluid-filled, pus-filled. More cases have occurred than has been the case historically for a long, long time. That may be a combination of
changes to the virus.
It may be the fact that we are now further and further away from when we all got vaccinated for smallpox. The smallpox vaccine provides some protection against this virus, and smallpox vaccination finished in most of the world in the 1970s up to 1980. And so that lifelong protection
still applies for those of us who are vaccinated.
But there are clearly many, many of us born since 1980 who will not have that
protection.
We do use the vaccine as what we call post-exposure prophylaxis. So for those individuals who've been exposed to monkeypox virus, can get the smallpox vaccine after being exposed.
And there's a window of 4 days for those individuals to get some protection from the smallpox vaccine.
So we're in conversations with the Commonwealth via HPPC about the national medical stockpile and the use of smallpox vaccine for those individuals who may have been exposed, who are in that window, as well as the potential for vaccinating a small cadre of healthcare workers who might be required at the front line if we get further cases.
Good afternoon, everybody. I'm here with the Chief Health Officer, Dr. Kerry Chant, and we just want to raise some concerns from the public health perspective. First of all, I'd like to address the fact that if anybody's in any doubt as to whether we have a flu season, don't be in any doubt. It is here, and you need to take it very seriously.
In the last week, we've had 129 admissions into hospital. Only 1 week ago, it was 60 admissions. Up to the week of May 7th, we had 2,000 cases noted. The week before, it was only 1,000 cases. So what we're seeing week on week is a doubling of the number of cases, and of course, doubling of the number of admissions into our emergency departments. Flu is an extremely dangerous condition. We have had, in past years, prior to COVID, and prior to all of the safeguards that people were taking, such as social distancing, using masks, hand washing, staying at home when you're sick, prior to that we had 2 seasons of particularly bad numbers of people dying from flu. So I'll ask Dr. Chant in a minute to give details, but it is absolutely crucial that all of us take this virus very, very seriously and go and have a flu vaccination. Now, I know people are over vaccinations. We've had vaccination discussions for the last 2 years, day after day, particularly around COVID. But let's not forget the reason why Australia has done so well is because we all went out and got vaccinated. 95% of people over the age of 16 went out and had at least the 2 doses of COVID vaccines. So on this occasion, what we're saying is look after yourself, look after your family, particularly look after the vulnerable people that the Chief Health Officer in a moment will highlight, but make sure you go and have the vaccine, the flu vaccine. Can I also add that we now have a very likely case to be confirmed in the next day or so of monkey virus. It presents with conditions that might be very similar to colds or flu, but move into having small pustules and rashes, and I'll ask Dr. Chant to highlight that as well. It can be transferred from one person to another by very close contact. I want to say thank you. As the New South Wales Health Minister, I am always stunned at what our GPs and our medical practitioners can do, but since we've never seen it in this country before, it is quite incredible that a GP managed to identify this illness on presentation to the practice. And I want to thank that GP, and I just want to say to all the GPs across New South Wales, you're doing an amazing job, but really to have the capacity and skill sets to identify something which hasn't been seen in New South Wales before is quite incredible. And thank you to all the GPs for all the work they do.